Welcome to our next episode on the discussion of cervical cancer with Dr. Promise Sefuga. Take it again from where we left off. I have been thinking about our conversation and it's quite worrying, but then again, I'm very excited because now there is information and there is solution out there. Doc, what are some of the lifestyle choices that one can make, to improve or reduce the risk of contracting cervical cancer?
So, like we have said, cervical cancer is caused by the human papillomavirus, which is chiefly sexually transmitted. So, high risk sexual behavior is the biggest risk factor. That's one. And so, like we always say, avoid casual sex, use condoms, and then avoid multiple number of sexual partners. That's extremely important. For the woman who has multiple sexual partners, or the woman who has sex with a man who has or has had multiple sexual partners, they are at risk of cervical cancer because they are likely to have been exposed to the HPV. The woman who does not get screened. So screening is extremely important. Now, screening basically means that we do tests to look for anything that would point to the presence of a disease when a disease has not started showing any symptoms yet. And like we said, cervical cancer can be cooking underneath, become what we call precancerous, and the whole of that is opportunity for us to detect and intervene. If we miss that, then it develops into full-blown cancer.
Wow.
The World Health Organization has a target that says that we should be able to prevent cervical cancer by the year 2030. 90% of girls should be vaccinated. All right. And then 70% of women above 35 should get screened. That's the target. And 90% of persons who have been detected of having the pre-cancer or having cancer should get treatment. That's the target. So screening, and that is everybody's responsibility. Every woman is a responsibility to get screened. You go do your cervical cancer screening. January is a month of massive awareness globally. This is what we are doing here. Take the opportunity and get screened. Once you screen and your results are negative, then you are good to start taking the vaccines. And then you protect yourself. There's no other way. Limit or minimize or avoid high risk sexual behavior. Get screened. Overweight and obesity also compromise your health. So healthy lifestyle, eat healthy, and then avoid casual sex. Use protection, and then minimize the number of children. We had said plenty more children also.
When it comes to the screening, at what age can one be screened for cervical cancer?
So any woman 25 years and above should get screened. And the schedules are, you get screened between 1 to 3 years. Every 1 to 3 years you get screened. Sometimes, depending on your first screening result, we say, and your age, we say, okay, you're due back in a year. Depending on your results and your age, we say you're due back in 2 years. Based on your results and your age, maximum 3 years. So every 1 to 3 years, every woman needs to get a pap smear or any form of cervical cancer screening done.
So does it mean that any woman or young girl below the age of 25 is not at risk, even if they are sexually active?
Because what happens is below 25, and a lot of the time the body is able to clear HPV infection. And so it wouldn't show anything. And cervical cancer is hardly seen below 25 years. This is all the information that went into that policy decision that we start screening from age of 25.
So with the vaccine, how often does one take? Is it a one-time shot? And if one gets vaccinated, do you still do the periodic screening after vaccination?
Good, yes. So the vaccine, we have different types. Generally, between 2 to 3 doses is the rule. And vaccination is most ideal when we give it to our young girls between the ages of 9 to 14. It is most effective because the idea is to give the vaccine so the body prepares the antibodies against the HPV before even these girls become sexually active and get exposed. That said, women at all ages are still eligible because the research has shown that taking it, no matter what age, gives you some protection.
Okay.
Compared to not taking it
at all.
Yeah. Right. So it's a call to mothers, fathers that let's get our young girls vaccinated before age 14 or by age 14.
Okay.
That said, other older persons get vaccinated.
But that's after screening.
Yes. Okay. And then when you get vaccinated, it does not stop you from your regular screening. Okay. We still have an important place to get screened regularly.
Interesting how cervical cancer probably seems like the only cancer that has a preventive measure that could be so.
There's a lot of room to
prevent it. Yeah.
So there is no reason why we should be losing women to cervical cancer. And increasingly, we're seeing advanced cancer stages in younger women in their 30s.
Wow.
And it's heartbreaking.
Wow.
Wow.
It's quite scary, like I said, but I am also very much excited that there is a solution to combat this life-threatening cancer, majority of the time in women and young women. So, could you please explain the role of the HPV vaccine in the whole cervical cancer prevention? I know you've touched on, like you mentioned, the WHO has a target by 2030. Does it mean that if everybody gets vaccinated, vaccinated, does it completely eradicate the cervical cancer?
It would reduce the burden globally. It has. And unfortunately, the highest burden of cervical cancer are in the less developed countries.
So I heard.
They don't have regular screening programs in place. Elsewhere, when your time is due, your doctor's nurse is going to call you, say, Madam X, it is time for your cervical screening. Here, we don't have those systems in place. We try to do that on a small scale, but that we wish should have been
on a national level, you know. Yeah.
Then the vaccination. The vaccine is a weakened form of the virus or portion of the virus. Will get into your body and then stimulate your immune cells to produce cells will be waiting. Okay. That anytime the virus itself gets in, they already prepared and they can combat. That's the role of the vaccine, and it's extremely important. That is the only way to reduce the burden globally. Wow. And there has been concerns about national policy to introduce it, and we continue to talk and make advocacy. We're making some progress, but until it becomes a national policy, we're told that knowledge is power. Once you get to know about it, take the steps, and then your protection is in your own hands.
So how effectively do you suggest that we create continuous awareness on this particular cancer in women?
So everybody talk about cervical cancer this month. When you see your friend, your schoolmate, your colleague at work, check with them. Have you done your cervical cancer screening? Have you been vaccinated? And then she also goes and asks, and then when you see your sister, your wife, your girlfriend, let's all talk about it. Let it be the commonplace discussion the whole of this month and afterwards. That's the only way. It's everybody's responsibility because we are losing young women in their reproductive age due to cervical cancer. We are losing mothers, leaving children orphaned as a result of cervical cancer. And they become a burden to you and I, become a burden to entire society. So everybody has a role to play.
So before I get to your final message to the general public and society at large, I'd want to find out if any individual, organization, community, group of persons that are interested, like someone like myself, that is interested in driving this awareness, is there a room for collaboration and partnership here at SHAPE?
Yes, sure, absolutely. It's one of the things we do, giving back to society, to share knowledge and make our skills and our expertise available. Partner with like-minded organizations to create knowledge, share knowledge, and make people aware and feel empowered so they step forward. And we do the screening for them as well. So there's room. You're welcome.
Wow, that's quite impressive. And that's a facility that has the community at heart.
When we do the cervical screening, the next thing may be the result is not clear. It is indicating some form of
like a window.
Then there's advanced further testing called colposcopy,
Oh,
where we
okay.
put a specialized microscope down the vagina to look at the cervix. And we're able to tell, okay, there's something developing in this area of the cervix. Then we zoom in and deal with it locally. And that those are some of the things we do here at our colposcopy center.
That's more like an advanced and technology, innovative way of detecting. Doc, earlier on you mentioned pap smear. Could you also throw some light on how the pap smear is done?
Yes, so the pap smear is one of the ways of doing the cervical cancer screening. So basically, the caregiver puts in this speculum that opens the birth canal so that we can see the cervix.
Okay.
And there's this special brush that we use to sweep over gently, and that removes the cells from the cervix, dipped in the container, and it goes to the cytology lab. It's a quick 2 to 5 minute thing.
Oh, okay.
That
Okay.
simple and easy, but yet that important and life-saving potential.
Okay. So, Doc, I have been having conversations with women. Sometimes I go to the salon to do my hair and I raise the issue on cervical cancer to speak to the women available. I engage friends here and there on cervical. And one thing that has always been cutting across is, oh, I'm afraid to go and check. Yeah, what if I go and check and I have cancer? What if I go? So please, what will be your final message to the general public and society, especially on this matter?
Cervical cancer is common. It's affecting and causing havoc in families. It's killing women of the reproductive and economically active age group, leaving their husbands and their children behind, and they suffer. Fortunately, we can detect the early stages of cervical cancer, where interventions are available and effective to prevent the full-blown cancer from developing. Regular cervical cancer screening, yearly or once every 2 years, and then the vaccination are important interventions that have helped various developed countries to get on top of cervical cancer. On your own, avoid high-risk sexual behavior. Keep a healthy lifestyle. Stay healthy. Talk to someone about cervical cancer. Let's team up together and prevent cervical cancer.
From our conversation with Dr. Sefuga today, Doc has enlightened us on various ways we can detect or get screened for cervical cancer. One way is the pap smear and the colposcopy. Colposcopy is an advanced way to get diagnosed and start treatment on cervical cancer. All of this is done here at Shape Healthcare. Shape is offering 50% discount on colposcopy and 40% discount on pap smear. I urge you all, and this is not a fight for just females or women. I encourage all men to take advantage of this huge discount that's offering throughout the month of January. It's running throughout the month of January for every woman out there to get screened. So men, I encourage you all to visit Shape Healthcare with your mothers, your wives, your sisters, your friends, your daughters. Let them get screened. Let them get vaccinated. This year we say, get informed, get screened, get vaccinated.